My name is Stephanie Nguyen. I'm a licensed marriage and family therapist with 10 years of experience counseling a diverse array of individuals and families. Detransitioners are a uniquely traumatized and rapidly growing population with complex needs. One of their most common grievances is that when they initially sought counseling for their gender-related distress, mental health professionals simply affirmed their gender identity and ushered them along a path of social and medical transition without exploring their reasons for wanting to transition or properly assessing their psychiatric comorbidities, trauma history, family dynamics, or internalized homophobia, and how all of these might play a role. Detransitioners now suffer mental and physical anguish daily, including pelvic pain, surgical scar pain, vaginal atrophy, infertility, inability to orgasm, inability to breastfeed, urinary tract infections, metabolic and endocrine disruption, osteoporosis, cardiovascular disorders, and early dementia. All of these ailments place them at increased risk of depression and suicide. These vulnerable patients were victims of therapists who neglected their duty to ask questions, evaluate comorbidities, encourage self-acceptance, and support healthy long-term decision-making.
Mental health was getting worse once they started the blocker. And that's against what the narrative tells us. The narrative says these interventions are supposed to make people better. We were pretty much putting anybody on testosterone at 13 and a half if that's what they wanted. It was getting to the point where we were harming more patients that we were helping, just by the numbers. What I am not in agreement with is this push to rapid medicalization of children. And it got to the point in the center where there was an actual directive that we were no longer allowed to use the phrase, "I have concerns about a patient." And in medicine, that should scare anyone.
My name is Alisa Weaver, and I'm a licensed clinical social worker in the state of Oregon with 10 years' experience conducting psychotherapy. I first learned about puberty blockers and medical gender transition of minors while working as a therapist in Las Vegas, Nevada. The dilemma that was immediately obvious to me was how to distinguish between those who will persist in a trans identity beyond adolescence and those who might be exploring a trans identity due to any number of complicating factors, including physical, emotional, or sexual abuse, poor self-image fueled or exacerbated by social media, sex-based bullying, digital or online exploitation, rejection of non-heteronormative expressions by family or peers, autism spectrum traits, eating disorders, etc. This dilemma does not seem so obvious to other mental and medical health professionals, unfortunately. The medical complications are not my area of expertise, but Finland, Sweden, and the UK all now agree that the benefits of puberty blockers and cross-sex hormones do not outweigh the harms and strongly discourage against giving these powerful drugs to youth.